So, my name is Associate Professor Rohina Joshi. For this particular project, I am a verbal autopsy expert who works across all the countries in the Data for Health initiative, but specifically for the Philippines and Shanghai. I provide that input for verbal autopsy. So, a verbal autopsy is basically, it's an autopsy by words. So you try and find out the cause of death by interviewing a relative of the deceased and go through that story of illness which finally led to death. And so in a sense, if you ask a set of standardized questions, you will get a response. So that's verbal autopsy, as in words used for causes of death. What we use in Data for Health is a smart verbal autopsy, which adds technology, so it adds that smartness, if you can say. It gets the interviewers to ask questions in a standard set. The tool has undergone vigorous research in several thousand deaths across the globe. So I think for the broader project, one of the key challenges was, well, where do we start from? You know, most of the deaths in these countries occur out of hospital, so therefore we thought verbal autopsy would be, or SmartVA would be a fantastic tool or an asset for the health system and the civil registration and vital statistics to use. Specifically in the Philippines, because that's where I've been working for the last 2.5 years, the challenge for us was that all deaths have to be certified by a doctor, irrespective of where they happened. And so for us to take SmartVA and train doctors to use SmartVA was something new. It had never been done before, but we were up for the challenge and we modified the tool. We tailored it for physicians such that physicians can now use this tool. The tool helps them to ask questions in a standardized way. It gives them a particular cause of death. And of course, because the death certificate finally is a legal document, it's the responsibility of the doctor to then look at the symptoms and say, yes, I agree with what SmartVA has said, and sign the cause of death. So we've seen now over the last 1.5 years since it's been in implementation how standardized the causes of results have been. There's no variation by regions in terms of how the questions are asked. So in all the other countries for the Data for Health initiative, we don't have enough doctors, so we have community health workers. Actually, most countries have community health workers who go out into the field and whenever there is a death, they use SmartVA on a tablet and get the cause of death. So those data are collected and analyzed centrally by the ministry or someone within the CRVS. And so they analyze it at a population level. So that's usually the system in most countries under the D4H. In the Philippines, however, because smart verbal autopsy is being used as a tool to help certify deaths, it's different because it has to be used for individual deaths to produce that one output. So that's the key difference between what happens in other countries versus the Philippines. But finally, in terms of the data usage, it's exactly the same. It's for the ministries of health to have a much better, clearer picture of what their population is dying of, and hence be able to provide or plan strategies or preventive policies and interventions for these populations. Most low and middle income countries don't have enough doctors. So, you know, you're talking about rural and remote parts of low and middle income countries where there are very few doctors. So there are no other options over there except for training community health workers or nurses. Now, Philippines has this unique position, and it's not just Philippines. I think few other countries like China and Colombia now are training doctors. That's taking it to the next level to produce much better quality. The final gold standard is medical certification of causes of death, where a doctor has seen the patient, where you have laboratory diagnosis to provide that perfect cause of death. I would see this as an interim process, and of course for verbal autopsies to be done by doctors using a standardized measure, I think that's a much more, it's the next step or next stage for verbal autopsies. When we started off, we visited couple of municipal health offices. We went to a couple of villages and we asked them what happens. how do they certify the deaths? And it was quite interesting because doctors basically are trying to certify these causes of death when they have no information. It's an extremely difficult job for them to do. They don't have any medical history. Sometimes even the person who comes for the certificate is not a relative, has no idea about what has happened. They just land up and say, can you please fill up this form? Because in the Philippines, you require the death certificate to bury the person. So I guess what happened prior to SmartVA was that the doctors just asked them, what do you think happened? They might say something, and the doctor would certify the death certificate. And in many cases, it would be old age, it would be cardiorespiratory arrest or respiratory failure. And of course, everybody has a cardiorespiratory arrest. You know, you stop breathing and your heart stops beating. And I think it's just for the doctors to then appreciate that this piece of paper was more than a piece of paper, that it adds value to the bigger policy of their country. I think going through that process in the training sessions was an eye-opening session where we have qualitative data from the doctors who said that I never thought of this piece of paper more than just signing it off. And I think going through that process has been quite rewarding, both for them as well as for me as a trainer to see that process happening. So I think in terms of using SmartVA, they like the process of being able to think through. They add more precision to the tool, to the certificate. Of course, we have issues with a health office has a lot of patients. They've got to then think about timing. But we are talking about a couple of death certificates in a week, sometimes in a day, which is quite manageable for most doctors. When we started off in the Philippines, we had proposed to use SmartVA for all community deaths. Well, we are still doing that, but the way in which we are doing that has changed. We had initially proposed to use community health workers. That was what we were doing in all other countries. But the country suggested that, you know, this was the practice and they wanted to use SmartVA for physicians. We then took the tool and have modified it to a point where now we have SmartVA on one device where physicians ask questions, click a button, get the causes of death, get all the symptoms endorsed, and then they can choose what the cause of death is. I think that is amazing. It's a great tool for doctors to use in their clinics without moving out or using any other tools. We trained about 120, 130 doctors and their ITs. The ITs are a mixture of nurses, midwives, sanitation workers, and people who with technology skills and knowledge. In terms of the physicians' acceptance, I would say the majority liked it, and we see them that they are using it. In terms of tailoring the use of SmartVA into their practice, they tailor it differently. Some people use a nurse to sit alongside with them to help them with connectivity, but things have now changed. We've offered them smart verbal autopsy on one device, which would help them further. And I think this is like any other technology where we'll have people who will just jump on board and run with it, while others will follow slowly, but will get there in due course of time. Okay, so in terms of impact of SmartVA on the Philippines, I think we are speaking in very short terms. In 2 years, we've rolled it out slowly, and we're still at the end of the pilot phase now. In this very short period, we've had a huge impact in terms of acceptance, in terms of understanding the importance of that piece of paper, the death certificate. I think for doctors to realize that and then make that change. You know, in a couple of years' time, we will see good quality data coming from villages throughout Philippines. I think that's the impact of it. For the Ministry of Health to see the data and say, well, we need to do something about non-communicable diseases for which we do not have policies in place, or probably policies are in place but have not been implemented. I think that's where we will see the impact of all these data that are coming through. And as you know, the theme of this, every death matters, and let it count, and let's see that change in intervention and in programs. So yeah, I think that's It's still many years to come, but we are seeing it in short steps, in baby steps right now.